Bedbugs and pesticides. Epidemic of bedbugs. In recent years, an increase in the populations of bedbugs has been recognized in many areas of the United States. In New York, for example, there were 192 bedbug-related complaints to the City Health Department in 2004 and 13,140 complaints in 2011. The increase in bedbugs has been accompanied, in many cases, by uncontrolled use of pesticides and related cases of poisoning. A few examples are illustrated in the following slides. Fatal poisoning in North Carolina. A 65-year-old woman complained to her husband about an infestation of bedbugs. She had a prior history of serious problems with her heart, kidney function, and diabetes. Her husband applied the insecticide, bifenthrin, to the floor, baseboards of their apartment, and their bed. He later applied 9 pesticide foggers in the apartment and sprayed the bed materials again 2 days later. His wife then applied pyrethrin directly to her skin. She lost consciousness 2 days later and died in the hospital. Her death was suspected to be caused by overuse of pesticides in her home. Ohio, 2010. An unlicensed pesticide applicator applied malathion, an organophosphate insecticide not intended for indoor use, 5 times in an apartment for control of bedbugs, treating the floor and the beds. A child became ill in the home the same day with diarrhea, followed by headache and dizziness. 2 adults became ill with nausea, headache, and dizziness. It was not possible for the family to remain in the apartment. Overtreatment. Madera, California. April 6, 2011. A pest control service applied 4 synthetic pesticides, pyrethroids, in a Madera apartment to control a bedbug infestation. Onslaught. Exponent. Delta dust. Nygaard. Dragnet. April 21st. The family returned. 6 family members became ill April 22nd through the 23rd. They were treated at the Madera Community Hospital for swelling in the face, burning, itching, and tearing of the eyes, a skin rash, and burning of the throat. At 9 a.m., April 14th, another apartment was treated with Dragnet, Onslaught, Nygaard, Delta Dust, and Exponent. The mother of the family returned to the apartment between 5:30 p.m. and 6 p.m. to open a window. The sheets on the bed were still wet. The entire family returned at 7:30 p.m. Upon lying down, the mother experienced irritation of the eyelids, like burning chili. At midnight, her daughter began complaining of burning of the eyes and itching on the face. At the community hospital, both received treatment, and the woman's son was evaluated for eye symptoms. Upon investigation, a total of 19 apartments were found to have been treated. A survey of the building's residents identified 2 additional cases with difficulty breathing, nausea, vomiting, rashes, throat irritation, sneezing, and tearing of the eyes. It seemed likely that others were affected who did not respond to the resident survey. The investigation documented overtreatment with 3 compounds. The amount of dragnet was 2.4 times more than permitted in one apartment and 4.8 times higher than permitted in another. Nygaard can be applied directly to a bed, but was applied 4 times higher than the permitted amount. Onslaught cannot be applied directly to the beds, and was applied 12 times higher than permitted to one apartment floor, and 16 times higher than permitted to the floor of another apartment. Discussion. What options does a renter have in this kind of situation? What other kinds of materials have been used to control bedbugs? Integrated pest control for bedbugs. Non-chemical treatments recommended by U.S. EPA for control of bedbugs include: cover the bed with materials that bedbugs can't penetrate, cleaning of mattresses and sheets, vacuuming, discarding contaminated items. Pest control can raise the temperature in an affected building for an hour to 118 degrees Fahrenheit, or alternatively, lower the temperature for 1 hour. Discussion. Which integrated pest management techniques can be done by a homeowner or by a tenant? How are cases related to pesticides or violations of proper application procedures reported? Reporting of cases. Reporting of illnesses. Report by the doctors treating the affected cases. Contact the Agricultural Commissioner in each county. State offices for reporting. Office of Environmental Health Hazard Assessment. Sacramento telephone 916-327-7319. Sacramento fax 916-327-7320. Oakland telephone 510-622-3170. Department of Pesticide Regulation, Worker Safety Branch. Telephone 916-445-4222. Fax 916-445-4280. California Poison Control System. Telephone 800-222-1222.